There's also some people out there that are doing a lot of things for the teams in town for the Chick-fil-A Bowl. Dr. Donnie Fowler from OrthoAtlanta gets to join us. And it's funny, Doctor, as this entire room of ex-college athletes, suddenly as you walk in, it turns into, I have to tell you about my shoulder tear, and Emily's got her stitches issues, and Tabitha is an ex-basketball player at Georgia Tech. She's like, my knee's bone on bone. Hudson's like the only one as a former Georgia quarterback that seemingly is mostly okay except for your back issue.
Yeah, I did slip a disc walking a dog over the summer. But it goes back to power cleaning in college. So
there's all that. But tell us about the involvement that you guys have with OrthoAtlanta, with the Chick-fil-A Bowl, and some of the services y'all are providing to the teams and their families.
Of course. Thanks for having me on. So we're proud. We've been involved with the Peach Bowl for over 20 years now, just about 22 years. So we're actually the longest-standing partner, even longer than Chick-fil-A or Coke or Delta or the other ones. So we're proud to maintain that relationship for such a long time. Hopefully we'll continue it going forward. But the teams come in about a week in advance, so they've already been here since this past weekend. So we got trainers stationed at the hotels kind of with the team 24/7, taking care of the players, the coaches, assisting their medical staff. We've had some family member issues sometimes that we always have to be ready for, so we're kind of a 24/7 concierge medical service, ready and waiting to keep them going up until the game, and of course at the game itself tomorrow.
And so if the Chick-fil-A Bowl obviously can look at you guys and say, we trust you, obviously that's part of the reason why I'm going, you know what, I've got a shoulder issue. And I already told you, it's like my wife, when we were having our first little one, was like, you can't get that thing fixed until she gets older. Is that the kind of service I can basically come into your offices and say, okay, let's get this thing done and then get myself on the road back to being able to use this arm again?
Yes, no, definitely. I mean, we have we have 14 locations, of course, the one right here in the Battery, which is convenient for a lot of people, but we're always, whether you've had surgery before, not had surgery, new issue, we could see you, we can work things up. Sometimes we have to get some imaging studies and then figure out a plan, and if it's something that needs to be fixed, yeah, we can take care of it and get you back on the road to recovery. We try to get everyone, whether you're an athlete, a weekend warrior, young, old, back to what you love doing and being active. That's why we do what we do.
As far as the elite athletes, obviously not me, but obviously these people from Michigan and Florida, I mean, these are elite athletes. What is kind of typical of what you're having to deal with? There's a lot of it of, obviously, a guy might have a surgery from earlier on in the year. He's still having to do some work. What are y'all typically having to do from that standpoint for these guys that obviously are in peak condition?
Yeah, so a lot of it, I mean, of course, both teams have their medical staffs here, too. We're kind of helping facilitate with them. A lot of it is kind of game situation. If someone comes out with an injury, a lot of times we're the ones running them back to X-ray, giving some of the imaging studies while they're there, making sure something's not broken so they can get back out on the field, while their doctors are staying out on the sideline in case something else happens. So we're trying to kind of coordinate both directions.
Is this an all-staff kind of deal when we get to this week where it's just like everybody from OrthoAtlanta, okay, everybody, let's go. We all have got jobs for this whole week of taking care of all of this? Yeah,
I mean, you don't want to have too many cooks in the kitchen. We got again, our trainers who are the backbone, Kitchy and Cindy, doing a lot of the hard work behind the scenes, and then we'll have 5 physicians down on the sideline on game day tomorrow, kind of working both sidelines to help coordinate everything.
So we got all that. We also had a dinner. Now, did you get to do that with both the teams?
Yeah.
Or how does that all work? What are all the activities y'all basically line up?
Yeah, so Dr. Schmidt, who's the medical director of the event, kind of set this up a while back because the teams come into town and the players and the coaches and everyone always has all these events to do, but kind of the medical staff, the doctors, the trainers, they kind of got left out of the mix sometimes. So we started having this medical dinner on Thursday nights just to get them involved. So both teams, Michigan and Florida, their doctors, their trainers, we all meet up, have a big catered dinner. Everyone gets to meet each other and talk and have a good time. So that was last night, and we really enjoyed the night.
So if I find myself, going to OrthoAtlanta, getting this taken care of, and then I come back throwing like 95 miles per hour, can I just tell everybody, listen, Dr. Fowler took care of this for me, and now I'm throwing 95. It's incredible. It's awesome. And then at that point, I can get a major league contract and marry the girl of my dreams and live in a hot tub.
Yeah, just drop like a hashtag OrthoAtlanta, something.
Hashtag
give us a little credit. So, but yeah,
that sounds perfect.
We can do that.
Well, hey, appreciate your time.
Hold on, I got a question for Doc
fire
real
away.
quick. Do you guys get to go in the team tent on the sideline?
It depends. There's only so much space on that pop-up tent. So
I always want to know what's going on in there.
Yeah, it's not as fun now when you can't see what's happening. But
see, that's my question. When did that? It seems like that's come into play. With a handful of teams, probably about 3 or 4 years ago, and now it's just become the standard around NFL and college that the pop-up tent is on every sideline now.
Yeah, I want to say Alabama was actually the first to start it somewhere in the SEC.
The biggest secretive team.
And they've kind of patented it, and now, everyone's kind of doing it. It gives a little more privacy for both the player and the doctors when you're evaluating them so that you don't have the mass public looking down on you. So.
I actually think that doctors and nurses are a rare breed, kind of like runners. I ran cross-country and track, and everybody just thinks I'm psycho.
You're crazy.
Kind of am. Yeah. But, like, when I was taking my own stitches out this morning, I just get, like, my stomach starts turning, and I get really nauseous. Did you ever have to get past a point where it was, like, okay, or what was, like, the most gruesome thing that...
I was just about to ask that.
Yeah.
I'm just, like, I love hearing about it, but
no.
I don't like...
Of course. Well, everyone's different. And first off, I ran track in college, too, so I don't think you're crazy for that part. But
we're both crazy now.
I think probably when it hits most people is when you're in med school and you have to walk into anatomy kind of cadaver class. And we'll have I saw there were 2 people in my class literally drop and hit the floor just when they saw a dead body. So I think that's kind of maybe when you first really know.
Oh, my gosh.
Yeah.
Fascinating.
So on the sidelines, what's the most gruesome injury you've ever seen?
I mean, the worst are usually those kind of open, like both bone, like tibia, fibula fractures, kind of like Alex Smith had recently for the Redskins, or sometimes even the knee dislocations can be really bad, like the UCF quarterback had about a month or so ago. So those are usually the worst, those really bad lower extremity
And
injuries.
you have to snap them back in place right then and
well,
there?
Well, not if they're completely broken and hanging off. I hope you wouldn't do that.
But let me ask you this, too, because the threat that some guys have faced where there is a lack of blood flow, and now it becomes a really serious issue, how quickly are y'all able to diagnose that and realize, hey, we got to get this into surgery as quickly as possible?
Yeah, so, I mean, you get a little bit of that from your immediate clinical exam, and yes, to some degree on the field, you are trying to reduce the knee, the leg, whatever it is, to the best ability to take the pressure off the nerves and blood vessels so you don't lose that perfusion. But then, a lot of times you're getting them immediately to the hospital. You're doing, different scans and blood work to kind of check the flow. And in some cases, you do have to have an immediate surgery, vascular repair, et cetera.
What about a guy like Tua, who we were talking about
earlier? I was
just
going to ask him about that.
Oh, you want to?
No, go ahead.
Oh, okay. He's come out and said he's 80 to 85%. The ladies here were saying that they feel like he might be over-embellishing because 2 weeks ago he had surgery. Can a guy recover in 2.5 weeks from an ankle surgery? And do you think he's kind of fooling us all? Maybe he's more like 70, 50%.
Yeah, and I think it's tough. Unfortunately, I don't know exactly what was done, but in his case, I don't think it was a break. I think it was more ligament damage that ordinarily you might just let heal, but by doing the surgery, they're trying to speed up the process and get better stabilization. So they probably put some kind of construct across just to help reinforce the ligaments and tendons to give him a little bit more protection when he's playing. So I do think it's possible. I'll be interested to see how mobile he is assuming that he comes out and plays.
I'm not trying to toot my own horn, but my doctor degree has to be in the mail because I said that earlier. Did I not? That surgery sometimes, because when I broke my wrist, they're like, well, we could do surgery and you'd be fine in 2 weeks, or you can let it heal on its own and it's going to take 6 to 8.
See, Dr. Fowler, here's the problem.
She got my own stitches.
She continues to break everything, so now she feels like she should be Emily PhD, and that's just not the case from this standpoint. But that's
the best way to learn, Los, is by example.
Just keep breaking things. That's what she keeps doing. It's Dr. Fowler from OrthoAtlanta. Hey, appreciate the time. Appreciate the work you guys are doing. And obviously, it's going to be fascinating to watch some of these guys, especially tomorrow, even with Tua Tagovailoa, and then see, obviously, with Florida and Michigan, to see how this game plays out and basically how that kind of sets the tone for 2019 for both those teams.
Yeah, no. Well, thank you for having me. We're excited for the matchup tomorrow. Hopefully, everyone stays healthy.
All right, appreciate it. Take care.
Who are you rooting for?
I'm impartial because I have to take care of both teams.
It's like Kirk Herbstreit on game day. He can't pick.
No, it's that saying. It's like calling the game. You can't have a preference to the teams. It's just kind of how that goes.